I hope this is okay right here.
Yeah, I think we'll
Okay.
be fine. Either way, like it'll pick up, especially since it's such a quiet room. I'm telling you, I've dealt with
Calle Ocho noise.
Gaiocho beeping, people yelling. There's like this tamale guy that comes
Oh
around and
my
he has like a
god.
tamale song, almost like a tamale ice cream man,
Oh my
if
god.
you will.
But I would be so down for that. I'd be like, the tamale
They're
guy is
jam.
here.
They're
Let's go.
jam. Every once in a while, we're like,
That
or the
makes it be
tamale guy.
interesting, I'm sure. That's
Oh
awesome.
man, but well, let's introduce ourselves, right?
Sure.
So I'm Dr. Linnett Molina. I have an optometry practice in Little Havana, and I'm here with my good friend from the Goldman Sachs classes that we've been taking. This is Dr. Cortez.
Hi everyone. Dr. Lissette Cortez, licensed psychologist, and my practice is in Coral Springs.
Yeah. So South Florida girls for sure. Were you born and raised in
I was born in Colombia
Oh, right.
and then moved here around like 11
Nice.
and then could not leave South Florida,
Yeah,
apparently.
I mean,
Just been here the whole time.
feels like home
Yeah.
already by
Yeah,
that time. That's awesome.
definitely.
Yeah, I was born and raised in Miami, but my parents are Cuban. But they came very young too, so it's almost like we've all been here for a really long time.
Yeah,
So home for sure. Hard
definitely.
to leave.
And then we both were at Nova
Yeah,
for some time, so that definitely
that's
feels like
cool.
home.
For sure, for sure. Living up in Davie for how long? How long is the psychology degree? Are you doing the whole 8 years as well, or
Yeah, so I did do my undergrad at Nova
also
actually,
okay?
which like it just happened to work out that way. So it was 4 years of undergrad
Yeah.
and then 5 years of the doctorate
Oh
program.
wow. Okay, long time. Yeah. Yeah. Optometry is 4 years. I mean, you can technically get into optometry school after three if you like plan the courses right.
Oh,
Finish up your bachelor's in like that first year of optometry. You get like a
nice.
you get like a bachelor's in like vision science or something like that.
Oh,
And then you do 4 years of solid optometry with an optional residency if you want to get into any specialty stuff, like if you want an extra year in pediatrics, ocular disease,
mm.
contact lenses, you can do something like that.
Oh, that's cool. But do
Yeah.
you guys have to do like hours towards like licensure?
We have to hit like a certain, I guess, like patient count when we're in our last year. So it's like a lot of externships and internships. So you're basically fourth year is all patients.
Oh, okay. Nice.
And you're probably finishing up a couple of your boards. So usually we have three boards. Usually you take part one in your third year, and then two and three in your last year while you're doing rotations.
Wow.
Yeah.
That's pretty
So,
long.
but if you pass boards and you get your degree, you're an
You're good to go.
optometrist. Yeah.
Nice. Awesome.
But yeah, so like the residency, a lot of people do it if they want to get into either they feel more comfortable after the residency to do a specialty,
Mm-hmm.
or if you want to get into like teaching at a university, or maybe even working with an ophthalmologist, in a certain clinic, they probably require it too. So,
Oh, very cool.
but yeah.
Yeah, similar to us. So we have like our 5th year is our internship year, and we could match anywhere in the country,
Wow,
which is wild because like
that is
half your friends like leave, and you're just like,
so
bye,
crazy.
I'll see you on graduation day.
Oh my gosh.
And that's when you get to choose really like what you want to specialize in.
Gotcha.
So I did my internship locally at Renfrew
Oh, cool.
for eating disorder residential treatment.
Nice. So you didn't
Um,
have to go far.
yeah, thankfully. I was like, I'll stay here. So even though I like interviewed in like Chicago and I was like, this is way too cold.
Oh,
I
so
was
did
like,
I actually. So I
oh,
was thinking about doing the residency and I was like undecided
mm,
between pediatrics and specialty lenses. And I decided to go everywhere for the interviews. So I went to
oh,
Chicago, I
good
went
for
to
you.
Houston. I think I had another
Wow.
one. I forgot. It's been a while.
Oh my, yeah.
But Chicago is freezing.
It was very cold.
Yes.
I was like, I don't know if I can do
Yeah,
this.
me neither.
And luckily we matched for Renfrew because they
Amazing.
rank you and you rank
Yes.
them. And if you match them,
Yeah, so it is kind of like our residency year for sure. It's just optional for us. So, because we graduate with all the tools to do everything, but for example, if I saw one 6 month old and I came out of school and was like pediatric optometrist, I would not feel very comfortable seeing
very
a
true.
6 month old,
Yes.
So those are
Yeah.
the ones that are very important. But
That's cool.
we come out with all the skills. So
Oh, nice.
I do specialty lenses, even though I didn't do a residency in it, because I did extra like continuing education courses and a lot of workshops. So
Yeah.
I felt comfortable with what I learned in optometry school and doing that to take that route as well.
Excellent. I think
Yeah.
it's definitely like a we get like a good foundation for
Hmm.
graduate school, and then from there we can kind of find our way a little
Exactly.
bit.
And did you know for sure what you wanted to do once you got to like that point? Or was it kind of like, oh, I don't know
Wh-
yet, I'm on the fence or
Yeah, it was surprising. So in undergrad, I was going to do substance abuse.
Okay.
For some reason, that was like what I
Okay.
thought I was going to do. And then my professor in undergrad, she had an eating disorders clinic,
And you fell
and
in love.
she was like, "Come do an internship with me, like like
Cool.
an
Yeah, yeah, yeah.
undergrad, like just go like sit in groups and whatever." And I was like, "Oh my god, this is literally what I want to do, like the rest of my life." And then when I graduated, and you do a postdoc year
Hmm.
after graduation, that's
Okay.
for a year under supervision to get your
Like kind of.
hours. Yeah, kind of like the postdoc I
Gotcha.
have right now. Um, and I ended up at an OCD clinic,
Cool.
and I was like, wow, this is like incredible. And you see so much overlap of OCD and eating disorders, anyways, that
Okay.
I was
So
like,
is it
oh,
like an easy merge
yes,
together for your clinic?
yeah. I was
Cool.
like, this is definitely the sauce.
Yeah.
So after that, I mean, opening this practice, the point was we're gonna focus on that specific overlap,
Awesome.
um, which doesn't get
A
like
lot of
seen a lot. Like they either do
interesting.
it like eating disorders or OCD, but like the overlap doesn't get seen a lot. So
Yeah.
I was like, this is what I want
That's amazing. And
to do.
you
Me too.
have, I have to mention the book that's coming out. That's
Oh, thank you.
exciting.
Yes,
That's so
yes,
awesome. You could
thanks.
pre-order it, by the way.
Yes, available now for pre-order.
And it's a workbook, right? Because I guess home training is very important for all these issues. Um, so that's amazing, and it wasn't out there. So now you're able to like combine that, put it out there for specific patients. I love it.
Yeah, I hope that it's a good segue for people maybe that are scared to go into treatment, don't know what to
Okay.
expect.
So it's more for someone that didn't have therapy or come to a session yet.
Yes,
Gotcha.
that's really helpful. I think sometimes it can feel a little less intimidating to explore this on your
Mm,
own
mm.
before like coming to a session and just having to like open up, and maybe that feels like too much. Or for some of our clients, we have them use those kinds of
Yeah,
workbooks,
yeah, yeah, yeah.
like for example, like the mindfulness workbook for OCD or the self compassion workbook for OCD. I recommend those a lot
Yeah.
for in between sessions.
And I'm sure those could be applied even not to OCD, mindfulness,
Yeah, I
all
do
of
like
all,
those.
all of
Yeah,
that.
yeah. So it's
That's
just good skills.
amazing. Yeah, for sure, for sure. It's funny because for things like vision therapy, we have a lot of tools that patients have to go home and do on their own, and
I
it can be
bet.
difficult sometimes
Yeah.
with like sending them home with homework and homework that maybe they don't like to do because maybe
Ugh.
you have to cover the good eye and you have to work on the bad eye. And
Oh.
recently there's been a change in how we kind of treat those patients at home.
Mm.
Instead of like patching is a little bit outdated now, we actually play a lot of red green colored games.
Oh,
So yeah, there's
interesting.
like an
Cool.
app and you get the little red green glasses, and that way both eyes are seeing something at the same time so they can learn how to work together versus punishing the good eye so the worst
Oh,
eye
that's
can
interesting.
force itself. Yeah, yeah, yeah. So it's
Wow.
fun. So
That's
yeah,
pretty cool.
all this like going home and doing it on your own stuff is important.
Yes. Do you think you have good like patient like follow through?
So when I was in school, we worked in a VT clinic, a vision therapy clinic, and um, it was like 50-50. For sure, the parent would come and be like, they did 30% of their stuff, and then they went and played video games. But a lot of the newer research, I think, is easier on the patients because it was a
Okay.
lot of like the patching, and that's
Mm.
uncomfortable, and it would be patching for the whole day, and now it shows
Oh.
that you can patch for half the day and get the same results. So it just depends on like the
Ah,
patient, but things are changing and I love it. And it's not specifically what I do. I definitely refer out for that, um, just because there's better docs out there for it than me.
and
But
that's great to know what your lanes are. We do,
yeah.
yeah. The patient follow through sometimes is difficult. So anything that can help, any tools and things like
Absolutely.
that. We use a lot of like apps.
Hmm.
There's one for eating disorders called Recovery Record.
Okay.
That's really helpful. It gives you like reminders of like when to eat, and it
Cool.
asks questions like how you're feeling.
Oh, I love
And we
that.
could connect like our phone to their app the same
Amazing, and
way,
you
so
can
we can
monitor
see it.
it.
Yeah,
That's
stuff
fantastic.
like
Yeah.
that. Sometimes people just need a little accountability and a little support.
Of course,
You know.
absolutely, absolutely. Yeah, I have to start because I do specialty lenses, and I'm here like you know putting it all together myself. Like, hey, this is what you need to be successful. Here's like a video on how to put it in and put in the contact, take out the contact. This is how you take care of it. And I would love to be able to. I guess that's on my project list, right? To record it myself, have it like
Yeah.
automated, and instead of me kind of copy pasting links and sending it in an email, I'm
Very
like,
true. Very true. Exactly.
owning a practice is hard.
It can be. And it's like we want to give our patients so many tools.
Yeah.
And sometimes it's like the types of delivery that they needed,
Yeah,
or like for us to be able to be available to them in the ways that would be helpful
exactly.
to them. I think that sometimes that's pretty hard.
Yeah, for sure. Absolutely. But well, I'm so happy for you for running a successful practice.
Same to you,
I
same.
think you've been in
Yeah.
practice now, well, overall, for how long? About
Well, I went into private practice 2019.
nice.
So, and graduated 2015. So now
Okay.
10 years of practice
Yeah,
almost.
congratulations
Yeah.
on your 10 year. Next year is
Thanks.
my 10 year from
Yes.
graduating optometry
Oh,
school, for sure, for
fabulous. Very
sure.
cool. And your practice has been open
So
since
we bought it in 2020, so
okay.
we are going to be 6 years old in January.
Oh, in January. Okay,
Yeah,
that's
yeah, yeah.
right
So
around
right
the
around the corner,
corner.
next month, next
Nice.
month. So, but yeah, I mean, it's in Little Havana. That community is very interesting and diverse, and yeah, we definitely get a lot of referrals from like other ophthalmologists, other optometrists that maybe don't do the specialty stuff we do, just like me with the vision therapy. Like,
Mm-hmm.
you know,
Totally.
I got my doc for that. You go over there.
It's
But
good to have those referrals.
yeah, absolutely. I find that I usually get doctor to doctor referrals within like the eye community versus like primary care or something like that. Do you feel the same way? Okay.
Same. Oh my God. Yeah, definitely. Like most of the time, our referrals are like other clinicians that don't
Yeah.
do what we do,
Yeah.
or that we send to them
Exactly.
when our client needs something that we don't do.
Absolutely. Yeah.
Yeah.
It's nice being niche in that aspect to be able
Hmm.
to help each other out because that's all that's
Yeah.
what it's about, you know.
Hmm.
Um
And I'm like, I totally hear you on the like, if that's not something that we do, or the patient's gonna get something better off with
yeah,
someone else,
exactly. Patient
go for
first.
it.
Like I don't
Yep.
you don't want me, checking your 6 months old eyes. I promise.
Right.
I haven't seen one since school. Now we know.
Exactly. I'm like, you don't
So
want me treating like your 6-year-old. Like
yeah.
I'll treat your
Yeah,
adolescent,
yeah,
your
yeah, yeah. We
teen.
all know our strengths,
Yeah.
which is important.
Mhm. Totally.
That's so great. That's so great. If you were to like reach out to like another profession, what would like that avenue be? I think you were saying neurology would probably be.
Yeah. So I think if we were to maybe connect with
Hmm.
other clinicians, we typically would get referrals, obviously psychiatry,
Yeah,
number one, but also a lot of times GI doctors
right.
for people who have eating disorders, allergists,
Cool.
cardiologists. Um, and because we work with a lot of health anxiety,
Yeah,
we do try to collaborate with medical providers quite a bit.
yeah,
Sometimes like our clients are afraid of going to the doctor and like getting a certain procedure done. There's that phobia of like
absolutely,
white coat
absolutely.
syndrome,
Of course,
right?
the white
There's
coat
that.
syndrome.
So a lot of times we do work with medical for those kinds of reasons. Um, even if it's not exactly like a related,
Right, right, right. No, I mean that's why
condition.
I wanted to talk to you so much,
Mm-hmm.
anyways, because I would love to know, what to look out for in my patients, how to make maybe the environment more comfortable for patients. What could we preemptively maybe tell them? Should we not warn them, but like,
Yeah,
and reassure them that when you're coming in, it's going to be a comfortable environment for them, or how can we do that?
yeah. Okay.
As far as environmental aspects, because again, optometry is very light, like
Yeah.
on light, on off light. You got to put your head in certain positions to examine. There's
Mm-hmm.
the anxiety of dilation drops because patients don't like things in their eyes. So
Totally.
anything like that. What kind of recommendations would you say that we can modify, change, or plan ahead for with patients with anxiety?
Yeah, I think there's definitely the component of like sensory sensitivity.
Yeah.
And a lot of times we see that on, autistic folks,
Mm-hmm, mm-hmm.
that might feel overwhelmed with certain things. Um, if we can help them understand the process very detailed,
Yeah.
that's going to be very helpful,
Gotcha.
right?
So
And
like now the lights are coming on.
yes,
Now the lights are going off.
exactly. Anything that's going to change, walking them through the process and
Absolutely.
being very detailed is going to be really helpful
Right.
for them.
Makes sense.
And even like ahead of time,
Hmm.
um, for anyone who is, who experiences anxiety, uncertainty is very distressing,
Mm,
right? Like not knowing how things are going to go, not
right.
knowing what to expect. And to a certain degree, it's something that we all kind of just
Of
function
course. Yeah.
with.
Anytime anything's new. Also, I feel
Exactly.
that all the time.
Yes, definitely, definitely. and at the same time, being able to carry through a medical
Right.
appointment. It's like if we can ease that process, like you're saying, then and the goal is, have your eyes checked, maybe
Yeah.
get the glasses that are going to be
Right.
helpful for you. Then we can certainly work towards getting the person familiar to the
Right.
environment. If they're open to it, could they come visit your office
Oh
on a day
yeah,
that they're not
absolutely.
like in an
Absolutely. Yeah,
appointment?
absolutely.
Cool. It's like,
Absolutely.
yeah, if they could come and check it out and look at the equipment and see what things
Fantastic.
are going to be like, that can be really helpful for someone who's feeling really scared of like, I don't, this is way
Right.
too much uncertainty. I don't know how to like handle it.
Absolutely. Yeah, they can definitely come visit. Usually I find myself probably examining their parent first, I mean, and then
Mm.
we, schedule them later or, vice versa, or their sister comes and like they watch them get
Awesome.
examined.
Yes.
Yeah, something like that.
That could be really
I do
helpful.
also with the drops because I mean, even grown-ups that don't have anxiety are like sometimes a little
Yes.
bit like scared of the drops. I love to kind of put it either on their hands so that they can feel that the drop's really not anything other than like wetness, right?
Awesome.
Um, and maybe if they, and I'm talking like kids more than anything because they're usually the ones that are a little bit more nervous for the eye drops. If they have like a little stuffed animal, I pretend to like put drops in their eyes and things like that
Awesome.
so
Oh,
that they
that's
can
super
like
sweet.
ease, yeah,
Yeah.
ease it. And we have ways of like not making it so much of a shock to the system. Like I don't pry your eyes open and put a drop in. I have you relax, head back. I put them in the inner corners, even with your eyes closed. Once you blink, they'll fall in anyways. Usually, we get
Awesome.
enough on there that it will
It
dilate
works
the eyes
anyways.
regardless. Yeah, 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 yeah.
Very
Cool.
cool.
So that's pretty good techniques
Yeah,
for
you
that
guys are
for sure.
definitely on the right path of that. Fabulous.
Sweet.
Yes.
Amazing. And if I, for whatever reason, am missing that, maybe that my patient is anxious, or I want to pick up on more cues, like what would you say me and my staff should look out for?
So I think we're from like physical to also like, emotional cues, right?
Yeah.
Physical, we might see a lot of like fidgeting, can't
Mm,
sit still,
yeah.
leg shaking,
Okay.
right? Maybe they're either too quiet or
Mm,
they're over talkative,
gotcha.
right? Maybe they're having a hard time um, like verbalizing what they
Mm,
need, right? So those might be things that
okay.
you can kind of tell like someone's
Right.
feeling a little more anxious and on edge.
For sure.
Um, and emotionally speaking, encouraging someone to explain a little further is really helpful. Like if you're finding that like they're giving you like one word answers,
Mm,
or they might just be saying like yesing you a
sure.
lot, right?
Okay. Interesting. Yeah. Because as a, an eye doctor, I feel like I do have a lot of explaining to do most of the time. So I find myself talking a lot.
Mm-hmm.
And I do find that, open-ended questions are better than yes,
Yes.
no questions
Mm-hmm.
for anything really. But that would be maybe something I can focus in on more if I notice some of those signs for sure.
Yeah.
Awesome. Yeah.
It also helps if you encourage them to bring someone with them,
Yeah. Absolutely.
especially if it's someone who has health anxiety. Sometimes anxiety can feel so overwhelming you kind of like shut down.
You like
Like,
feel solitude, like alone in
yeah.
it. Okay.
And when you're trying to understand like what your doctor's
Hmm.
explaining and you're feeling so anxious, not a
Oh.
lot is going to stick.
Oh yeah.
So it helps to have someone there who could also listen. Encourage my
Or
patients
have questions
also.
that maybe they are too anxious to ask.
Yes,
Hmm.
bring in the questions,
Yeah.
right?
Yeah.
Have them write them down before the
I
appointment
love that.
because sometimes you can get
This is
there.
helpful for me. I need to like start doing that too.
Awesome. Yeah, I'm like, what do I do? Because
Maybe
I
I
didn't.
have some medical anxiety.
Oh, I definitely do. Definitely, definitely. So
Yeah.
it's been like a learning curve of like what's kind of worked to get through the
Yeah.
process,
Yeah. Yeah.
and
Yeah.
knowing that it's not going to be perfect,
Right.
and that's something like I would work with my clients on
Hmm.
the this is not going to be perfect, but we want to make sure that you meet that goal of completing your appointment.
Absolutely. Right.
You
Because
know.
it's important, right? We got to
Hmm.
get through it. At least it's once a year with us, usually,
Yeah.
especially with the type of, specific people you work with. I would love to maybe go over some of the things that I would say can show up in the eye as well.
Yeah.
With someone that maybe has an eating disorder, malnutrition, things like that. So I know that when we're looking at the back of the eye and the optic nerve, sometimes we can find that the nerve is a different color than it should be. Maybe
Interesting.
not only the color, but also the shape of it can change on us as
Wow.
well. So things like that are important
Hmm.
and really important to get your eyes checked once a year for that as well, especially if you're experiencing some blur that we were talking about earlier. Like blur can be a sign of so many things. We do rule out all the really scary stuff,
Mm.
but at the end of the day, if it's anxiety induced, like I would love to be able to say, hey,
Yeah.
we need to talk to a psychologist because I think this might be not fixable with glasses.
Or if it comes on like sporadically,
Right.
right?
Yeah, it
That's
varies a bit. It
hmm
depends on maybe, is it coming on when you're studying for an exam, stressed out for school, or something, coming up that maybe, you're not even sure that it was stressing you out, because that can happen too, right? Like your unknown anxiety, maybe. Yeah.
Oh, definitely, definitely. And if we're working with, someone with like health
Mhm.
anxiety,
Mhm.
a lot of times these are people who are hyper vigilant of anything that they feel in their bodies. So even like something like blurry vision,
Yeah.
they become hyper focused on that, and then it becomes very catastrophic. Like,
Oh
oh my
yeah.
god, there's something wrong. There's
Absolutely.
definitely something with my eyes. Like,
Which just snowballs, I imagine. I
exactly,
imagine. Yeah.
anxiety gets higher. So definitely a lot of psychoeducation on like what anxiety looks like
Right.
in the body
Right.
can be really helpful.
Absolutely.
Um, but I love that you mentioned about like changes in nutrition and
Mhm.
how that can affect vision
Oh yeah,
too.
absolutely,
Yeah.
absolutely. Um, you can also have eyelid twitches, which I'm sure everyone's had, and
Mm-hmm.
that could definitely be stress induced. So any sign like that, we might want to take a step back and be like, let's look deeper into
Yeah, like
something else.
what's going on here?
It's
What's going
nothing's
on?
probably wrong with the
Yeah.
eye. Let's see if anything else we can pinpoint the cause.
Yes. And I think it's so interesting because we get a lot of people who um may say, well, this person is in like a typical size body, let's say. Oh, they're fine. Like
Yeah,
their nutrition is okay.
sure,
But they don't see like the underneath,
absolutely,
right?
absolutely.
And there could be someone who I don't love to say this, but like looks
Mm-hmm.
normal, right? But they're very malnourished.
Gotcha.
And
Yeah,
you
because I
know,
mean that's hidden usually. You don't have to be a certain body type to not be healthy, So
exactly. So
so
even like checking your eyes out,
yeah,
understanding that like malnourishment can lead to
absolutely.
affecting your
Yeah,
eyes.
absolutely. I mean, one good example is always my diabetic patients. Like you need to get your eyes checked every year, even if you look normal, feel normal, because blood sugar can definitely mess with your retina. It can cause bleeding, scarring, retinal detachments. That's blinding diseases.
Oh,
So, super important nutrition
yeah,
and all that, you know, underlining stuff
that
for sure.
makes a big
Hmm.
difference,
Hmm.
definitely. And do you find that like people feel receptive when you're sharing this information?
So I try to make it so that, like, almost like that we're like looking at it together. Like, look, you see this? This is what I see. This is not really normal. This
Mm.
is why it's not usually normal. And then I kind of ask an open-ended question like, have you been checked by your primary care doctor and everything's been good? Like, so stuff like that, kind of veer them into that conversation versus being like, this is diabetes. You got to go do this.
Yeah.
Not, I'm not an aggressive practitioner. At least I like to
I
think
can
so.
imagine.
I've been there though.
Definitely.
That I've been referred patients that doctors have been like, you're going to go blind in 6 months. And I'm
Oh,
like,
geez.
okay,
Okay.
let's take a step back because that
Yeah,
might cause a lot of anxiety.
definitely.
I had a patient that he was young and he was getting seen by an ophthalmologist, and basically his myopia was progressing rather quickly,
Mm.
and the doc was like, prepare for the worst because if it keeps progressing like this, he's going to need a walking stick. And I'm like, why would you ever say that to a mother and like this 10-year-old? They came to me. I was like, listen, it's high, but we can control it. There's something called myopia control now, that we reduce the
Well,
progression of it so that you don't have higher risk of glaucoma, retinal detachments, and things like that.
that's fabulous.
So she literally comes to see me every year. She's like, you saved my son's eyes. And I feel like I wish I could say that was 100% true, but it's mostly like I was, there's other options. You don't have to go with the doc that kind of drives up the anxiety and
Right, right.
gives you no alternative per
Yeah,
se.
absolutely.
Yeah.
Like I find that I don't know if maybe it's like maybe like a little more old school
Yeah.
perhaps, where this kind of like scare you
Mhm,
straight
mhm,
type of
mhm, mhm.
thing of
Bluntness,
like,
like,
yeah. I'm like, actually, that shuts people down.
yeah, yeah,
That actually
100%,
is much more difficult, I think, to
100%.
overcome.
Yeah. And then to say the opposite, one time I did have a patient that maybe I walked them through what was going on a little too. Uh, the tone was off, right? That I had to actually be like, wait, take a pause. I know I need to actually send you to the ER, and I don't think you got that
Okay,
from what I was
let's
saying.
be clear.
Let's be clear
Also.
for a second. Also, yeah. So
Hmm.
she was having a hypertensive crisis, and her
Oh,
optic nerve was swollen, and I'm like, and she's like, but I feel fine. I'm like, I know you feel fine, but
that's not the case.
like blood pressure is like 180
Oh,
over, 96. Like we gotta really send you somewhere.
yeah.
So double-edged sword in that case. But that's learning experience from practicing and
Hmm.
and just dealing with patients and how I deal. So
Right. And I
yeah,
think, I mean, I think as like clinicians, we,
yeah,
at the end of the day, what we want to do is like help people, take care of them,
absolutely.
make sure that they're well and healthy,
Hmm.
right? And sometimes that means that we do have to explain things as they are.
Yeah, difficult
Maybe,
conversations. Hmm.
yes. I
Hmm.
think the way that we deliver things makes a big difference.
Absolutely.
But at the end of the day, like sometimes I've had to have very difficult
Hmm.
conversations with, my clients around, listen, like, you need a higher level of care. This
Yeah,
is not enough.
yeah.
You need more support, or you need more sessions,
Hmm. Or maybe they're not following up when they're supposed to, and
right.
that's a big deal too. That's a big deal too. Not listening to not being non-compliant to what your treatment would be.
Absolutely. And it's we also function from like a very like ethical standard of
Hmm.
care,
Hmm.
right? As
Hmm.
clinicians, we definitely keep that in mind. And many times I've told my clients, like, it wouldn't be even ethical for me to see you here,
Right, right, right,
right?
right, right.
When you're in the
Absolutely,
state.
absolutely.
And again, difficult conversations to
Yeah,
have, but like at the end of the day, number one thing is do no harm.
yeah. Number one, number one. Do you find yourself having a lot of like those emergency situations, or that doesn't really?
Yeah, I mean, so typically what we do with our clients, because we do see higher acuity than
Sure,
like traditional outpatient,
sure.
and we with these cases where there's OCD and eating disorders, they can be such delicate
Mm,
conditions to treat. So what we do is we typically give people a 4-week plan,
gotcha.
and in this 4 weeks, we hope to see these changes, or like this
But I'm
improvements.
sure it's not like a straight line.
Yeah,
Like there's the
definitely
100
not.
ups and downs, I imagine.
It's assessment all throughout the four
Hmm.
weeks,
Hmm. Hmm.
but it's just to give them a framework of like when we meet
Yeah,
for like a team meeting in 4 weeks, we plan the next four,
gotcha, gotcha.
because it can't be an ongoing like, oh, we'll see if you get better,
Right,
right?
right, right,
Like
right.
we'll
Or
just
like
kind
so
of,
cookie cutter. I imagine you adjust the plan at those 4 weeks too. Like,
exactly,
yeah.
sometimes we have to include more sessions, or
Mm,
sometimes we can say, okay, we're gonna bring these back a little bit, we're gonna include your
yeah.
family, um, so we try to kind of give it in like smaller chunks where
Hmm.
we have enough ability to like act when we
Yeah.
need to, and not prolong this like, oh, we'll
Of
see her for
course.
like 10 weeks and
Of
then
course.
figure out what's
Yeah, yeah,
next.
yeah, yeah, yeah. Oh,
Yeah.
that makes total sense. I like that. I like that approach a lot. That's awesome.
Oh, thanks.
Yeah, yeah, yeah. Amazing.
What about for you guys? Like, what are some of the maybe more difficult conversations that you tend to have in your practice?
I feel like one of the ones that it's hard for a patient to understand is usually glaucoma, because
Oh,
glaucoma is one of those things that you can see 20/20, you can feel absolutely nothing,
mm,
and it's easily missed if you're not coming to your routine exams, and it could leave you blind, like blackout blind,
oh,
um, if left untreated. So
gotcha.
there's more aggressive ones and slower ones, and there's a ton of different types. But explaining to a patient like, "Hey, now I got to put you on treatment," and they're just drops, and I say just drops because there's worse things, right? But drops for life is always a little scary to
Okay.
patients, and again, for something you don't feel, you don't see, I have to put this
Mm-hmm.
drop to not go blind. It's a difficult conversation. I usually find myself having to kind of walk them through two or three follow-ups
Oh,
of
okay.
explaining that
Yeah.
to like actually get them to understand and be compliant. But the good thing with glaucoma, and the main like I guess like the more primarily present one, is usually a
Mm,
very slow moving disease. So it's not
okay.
like if I wait two or three follow-ups, like it's going to all of a sudden be detrimental. So,
Oh, yeah.
it's I take my time. I do see them pretty often, as opposed to someone that maybe is just a suspect. That I know if someone's going to be diagnosed with glaucoma because it's showing, I will see them a little bit more often.
That's great.
And there's things that are changing. Drops used to be our number one line of therapy, but there's a laser procedure now that you can
Oh,
do that
awesome.
lowers eye pressure for 5 years. It's repeatable. You
Oh,
maybe
very
don't need
cool.
the drop. If you're a little bit older and have cataracts, we can take out the cataract. Not me personally, it's an ophthalmologist, but you don't want me doing that either. We can take out the cataract that naturally lowers your eye pressure because
Oh,
the
very
thing
cool.
taking up space. You
Mm-hmm.
take that sucker out, less
Awesome.
buildup.
Mm-hmm.
And during that surgery, there's options to do a secondary type of surgery that will also lower eye pressure. So there's lots of
There's
options.
a lot of options.
Yeah, so
Mm.
there's lots of options. So again, explaining all that in one session is really hard. Like you said, if someone's anxious and they hear like all of a sudden I have glaucoma, I'm sure it
Mm.
just goes like "Ee," while I'm
Yes,
explaining
definitely.
the rest of the stuff.
It probably
So
doesn't sink in. Yeah.
yeah, so
Mm-hmm.
yeah, I do find that my best and most compliant patients, I go, hey, it's looking like this. Let's confirm it at the next one. Once we confirm it, these are kind of the options. I give them like an overview,
Awesome.
um, and I reassure that like we caught it in time. You have not lost any significant vision because it usually the problem with it and why we don't notice it is that it starts from the outside in.
Oh, okay.
So
Mm-hmm.
like you can still see details, but then you might starting to bump into things,
Oh,
or you missed a stop sign
oh,
because you
so
don't have that.
peripheral.
Yeah, it's usually
Mm,
peripheral stuff, and our
got
brain
it.
likes to fill in empty space or non-seeing space with what's around us. So if you don't, let's say you have two chairs over here on the side, if I'm looking at this chair and I have a blind spot here, it'll fill it in with white wall and gray floor.
Interesting.
Yeah, so I will
Wow.
miss the chair completely, but it won't look like a black spot per se or like an empty spot.
It's incredible what our minds can
I
do.
know, but that's why it makes it that much harder to notice.
Makes sense.
Mhm,
Wow.
mhm,
So
mhm.
it's like, yeah, I like that you are giving them like, we're gonna follow up, we're gonna talk about it again. This
Yeah,
is gonna be like an ongoing
yeah,
conversation
yeah.
also.
Mhm.
And even though you know action needs to happen, you're
Absolutely.
also giving them a lot of agency of
Mhm.
like we're gonna look at the options.
Absolutely.
Yeah, I think
Absolutely.
that really helps for people to feel like
For
they
sure.
have like a little bit more of a say in
Mhm,
like
mhm,
their course of work,
mhm.
like their treatment.
I do find patients love that, obviously, but at certain times too, they want you to make a decision because you're their doctor too.
Also true.
So it's again, like I'm still trying to like kind of pick and choose which patients I need to be a little bit more like I need you to do this
Mm-hmm.
versus I think we should do that. Um, and I mean, the good thing with glaucoma, there are
The
options
options.
for sure.
Cool. Cool.
But yeah,
Cool.
that's one of the ones for sure.
Yeah, I think the medication conversation is
Hmm.
challenging. And even though, like, I'm not a prescriber,
Yeah,
so usually this would be more of a psychiatrist
right.
conversation. But my patients will come to me and ask me, like, do I really need to take
Hmm.
meds? Like, should I really, always defer to
Of course,
psychiatrists
of course.
first. But when we talk about the benefits of it for like therapy,
Yeah,
you know, honestly, especially for people with OCD, when OCD
especially
is
with your
very loud,
experience. Yeah.
it's so helpful and
Wow,
people feel such relief.
that's so good.
It's very like I definitely encourage them to even
Hmm.
just like consider or have the
Right.
conversation with a
Yeah.
psychiatrist to see, what could be like a slow pace start.
Mm,
Um, but what's interesting is oftentimes they'll like tell me like I just don't want to take medication for the rest of my life
gotcha.
or forever, right? Um, so one of the ways in which I've been approaching
Hmm.
this, right, is like, oh yeah, like it's a condition that you need to treat.
Hmm. Hmm.
Basically, that's what it comes down to. And I tell my patients that we all have the condition of having teeth,
Oh,
and you do need
need
to
to
brush your
brush your teeth
teeth
every day?
every day,
I love
twice a
that.
day, 3 times a day,
I'm
right? We have
probably
to
gonna
floss.
steal that.
For sure, go for it, go for it,
I love that.
because we
Yeah.
don't question that. It's like we
Exactly.
need to do that every
It's
single
it's a
day.
new routine, and unfortunately, we
Hmm.
need to switch it up sometimes, but it's gonna be part of your life.
Yeah,
Yeah. Yeah.
exactly. And I think like meds just get like a bad rep,
Yeah.
but it's like this is is so helpful,
It is.
and
Absolutely.
if you had any other condition, at least for mental health
Yeah.
meds, if
Right.
you had any other physical condition, you would probably just take your medication and not even think about it twice.
Exactly. Exactly.
Um, but somehow for like mental health meds, it's just like the
That's, yeah,
stigma
I'm
that comes
sure.
with it, I
I'm sure.
guess.
Yeah. 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 I mean, man, I can't even imagine. Because again, yeah, that stigma is there, and I'm sure they're very nervous about any kind of change like that. Again, lifelong change.
Yeah.
But I love that metaphor with the teeth. I'm totally gonna steal
Go for it. Go for it.
that.
I hope it helps.
For sure, for sure. That's funny. But yeah, I mean, when it comes down to medication, I try to avoid it too as much as possible. There's just certain things that like, hey, like it's either this or you risk losing sight, and nobody questions after that. They're like, you're right.
They're like, no, I actually want
No, I
that.
kind of, I kind of still want to see.
Like,
So
actually, let me keep that.
yeah, 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 yeah. So important.
Hmm. Definitely.
That's funny.